I'd now like to introduce our presenter for today and throughout the rest of the series, Tony Klein. Tony has a Master's of Public Administration degree with a concentration in healthcare management and holds numerous credentials in substance abuse counseling and training. With over 30 years of administrative, clinical, and training experience, he is known for his work as an advocate for addressing tobacco dependence and addiction services and the development of a tobacco intervention model that utilizes evidence-based practice guidelines anchored in 12-step teachings and therapeutic community principles. Mr. Klein served as a member of New York State Partnership for the Treatment and Prevention of Tobacco Dependence, the work group that consulted New York State Office of Alcoholism and Substance Abuse Services on drafting Regulation 856, requiring 1,500 New York State certified substance abuse providers to develop tobacco-free services. Mr. Klein has coordinated the establishment of a continuum of tobacco interventions linking inpatient and outpatient treatment and has served as principal investigator for a 3-year study to evaluate a systems approach for tobacco-free residential services. He provides consultation, training, and technical assistance to community providers, municipalities, and state agencies. In addition, Mr. Klein serves as manager of outpatient services, Rochester Regional Health, Unity Chemical Dependency in Brighton, New York. The American Lung Association has brought Mr. Klein to statewide conferences and has really appreciated his insight about the relationship between tobacco and addictions. And we are happy to have you join us today, Tony.
Thank you, Janelle. Good morning, everyone, and hello. I hope everyone is enjoying the spring-like weather that's starting to kick in here. This is the third webinar in this series, and I think we might start by just briefly recapping the previous webinars that we had. Webinar number 1, we discussed the rationale for addressing tobacco and described an integrated recovery-oriented model where tobacco interventions are provided within the framework of existing alcohol and drug programming. Webinar 2 was devoted to client engagement strategies. Tobacco awareness counseling is the use of motivational interviewing and narrative therapy approaches. Having routine client-centered group discussions to explore the impact of tobacco on drug recovery promotes change talk, enhances interest in the topic, and helps to denormalize tobacco use in the treatment culture. Today, in Webinar 3, we're going to discuss behavioral change. So this is practical counseling skills to help our clients to establish and maintain tobacco abstinence. Our learning objectives include identifying 2 fundamental components of evidence-based tobacco dependence treatment. We're going to identify counseling strategy to verify and bolster client motivation, as well as describing 6 coping techniques to assist with the development of a personalized tobacco recovery plan. Now, you may recall the importance we placed on using terminology to create a positive vision of a recovery-oriented approach. Tobacco recovery, that term, implies a very different process than smoking cessation. Recovery is addition, not subtraction. As we learn healthy ways of living, it gives us the opportunity to let go of unhealthy ways. So using language that is growth promoting and solution focused reinforces a message of hope for the behavioral change. This vision of hope is advanced when we establish a therapeutic alliance that is autonomy supportive. We emphasize choice making as we explore strategy for alcohol, tobacco, and drug-free coping skills. Self-determination theory teaches us to be collaborative rather than prescriptive or controlling. The focus is on evolving an understanding of replacement behavior. It's not how long can I go without a cigarette. It's what do I do instead. That fosters a progressive learning environment and advances client self-efficacy and motivation. Now, readiness is determined by 2 indicators. We talked about this. And the profile that we know within our clinical population is that importance to abstain from tobacco use is actually rated fairly high, where confidence is very low. And what that tells us is that we need to focus more on teaching folks the coping skills that they need to boost their confidence level and help them move forward with the behavioral change process. Now, this is why we have two levels of behavioral interventions. We have tobacco awareness again, which is the cognitive change, the engagement, talking about this, making it part of the dialogue in a routine type of fashion within our programming. And now today we're going to highlight and specifically talk about the behavioral change, how to learn coping skills, elevate that confidence, embrace the lifestyle change through the different interventions and components of what we're going to identify as being part of this recovery process. Applying this to stage readiness, we are going to recognize that this is for folks who are in a pre-contemplative or action stage of change. When we're engaging those in a pre-contemplation or contemplation stage, we want to use motivational interviewing. Tobacco recovery counseling is preparation and action. So it's more of a cognitive behavioral therapy style of what we're going to be using. The goals are, we have three primary goals in tobacco recovery. Thoroughly process motivation. You want to not assume why this is important for someone, but to really process their thoughts and feelings of how their life is going to be better tobacco-free. Identify the severity of their physical dependence on nicotine. We encourage the use of nicotine replacement therapies and pharmacotherapy. We have to make sure that we're developing a strategy of proper dosing. And then again, looking at what type of replacement behavior, behavioral modification, development of coping skills that need to be applied to the specific plan. This is a program, the components of the CBT program that Dr. Gottlieb, Jennifer Gottlieb, did this at Mass General. This was a MICA program, and you can see it was 10 years ago already when she described her program, but it was very interesting to me to see how she was approaching the curriculum in her program, where it spoke to, again, a full understanding, tracking and understanding the tobacco use behavior, where she then could identify the replacement activities and coping strategies, looking at the reasons for the tobacco use. If you use tobacco to manage stress and you don't want to smoke anymore, the focus has to be on the development of alternative ways of managing stress. So again, this growth promoting solution-focused type of way of approaching the topic. Learning about medication and nicotine replacement therapy, again, there's a lot of misconception and misunderstanding around the pharmacotherapy, so having some education on that is very important. I'm going to speak very specifically about managing craving and withdrawal, which I think is a very fundamental component of how we can elevate confidence by having people understand good ways of approaching that. Assertiveness training. If someone offers you a cigarette in a common situation where they would have in the past and now you're not using tobacco anymore, how are you going to respond to that is something that we also include in some of our counseling. Relapse prevention, and again, becoming a person in recovery with regard to alcohol, tobacco, and other drugs. Now, when I start working with someone, I will typically show them the stages of change model. And I do this because I really want to see where they identify to the model. So some people tend to be very impulsive, where they'll come up with an idea that I need to stop smoking, and they're knocking at your office door and asking you for help. And so the idea is to really assess where are they in the stages of change so that we can identify what would be the best strategy to help move them through the model. You're not in pre-contemplation on Monday, in action on Tuesday. We know from the research that this is sequential. So there's tasks that processes that people walk through as they move from pre-contemplation to preparation and to action. So I will provide just a very brief little explanation of what the title of the different stages of change means, and then I'll ask people, where do you think you are on the map? 90% of the time they're going to point to contemplation, or they'll say, well, I have 1 foot in contemplation and 1 foot in preparation. And so that's where then the discussion will lead to, well, these are the things that we have found to be helpful with regard to someone who identifies to that stage. And then I negotiate with them, how do we pursue the counseling? And could I meet with you once a week, where we would then start working on some of the strategies that we need to address. So basically you're slowing them down in a realistic way. It's not, well, you want to stop smoking, here's how you use a patch, go for it and good luck to you. It's really, this is what we know about it. I'm very happy to hear that you're interested in doing this, and you can work on this with me, and we're going to figure out a way that's going to be sustainable behavioral change for you. And again, discuss that with them. Negotiate how that's going to unfold in terms of the time that you're going to meet and how you're going to work on walking through that stage process. I will always begin by thoroughly exploring motivation. The first question will be, how is your life going to be better tobacco-free? Now, we want to do this because we want to make sure that we're thoroughly understanding, not a superficial, but more of a deep understanding of the way that this person is identifying tobacco to be a barrier to something in their life, and how letting go of tobacco is going to improve upon that process. Let me give you an example of that. I'm thinking of a situation of a gentleman I had met with a while ago who, as we began the discussion around how is your life going to be tobacco-free, he indicated to me that he has 2 young sons, and his 8 and 9-year-old children are at a stage of life where they like to fool around in the backyard and toss around a football, and they want Dad to join them. And this man said, I'm embarrassed, but I don't go back there. I'm trying to avoid that situation because I'm just so short of breath, I can't handle it. And so he said, I'm actually avoiding my children when they're asking me to go in the backyard with them. Now, someone who is medically trained might lead that discussion into talking about the shortness of breath and why your airways are obstructed, and that type of direction of the dialogue, and that would be fine. But we can also go into a direction of then talking about the role as a parent, where the reflection that I would use to hearing something like that, which is what happened actually, was, so being a parent is important to you. Your role as a father is being interfered with due to your tobacco use. We spent probably 20, 30 minutes exploring that and talking about that. This man also was a high school English teacher, and so I asked him to write a letter to himself, a letter of encouragement as an assignment for our next session, where in his letter he was going to explain to himself why at this point in his life it's time for him to let go of his tobacco use. He returned at our next visit with this very beautifully written letter of really in-depth processing his thoughts and feelings about the importance of his role to be a father, a role model to his children, how he wants to be part of every aspect of their lives as much as an involved parent can be, and how this. So basically what I'm saying is that he took time in really processing thoroughly his motivation in a very thoughtful way. Now, once that type of processing takes place, I often will ask someone to draw, and we did this from the letter, draw a slogan, just a phrase that would then symbolize the meaning of everything that he thoroughly processed. And that can be then used as a tool when we go down the road to reinforce his motivation when he's meeting challenging moments and things of that sort. I have a jar of polished gems stones in my office, and often I will ask somebody to attach their slogan or their motivation to that. Would you like to pick out one of these stones and then carry it with you? And that stone then would be symbolic of the motivation that you have. So I believe that really processing motivation in a thoughtful way, I may spend 2, 3, or more individual sessions exclusively talking about how is your life going to be better tobacco-free. And when doing that, I feel that we get better outcomes. That, again, it is more targeted, it is more focused, and we kind of set the stage then for the behavioral change process in a more meaningful, significant way. Now, the second part of this, if you're going to embrace tobacco recovery, you have to know what tobacco recovery it is. How do we define it? And this is what my patients have taught me over the years, is that we break it down into 3 areas. The way you become hooked on tobacco is then the way that we have to develop strategy to address each one of these 3 areas. Part of it is physical, the nicotine thing. How severe of a dependence do you have on this substance? Part of it is habitual, cup of coffee, cigarette, turn the key in the car, I light up. So we want to identify that there's reinforced patterns of behavior that's associated to the cigarette, which may have nothing to do with how much nicotine you have in your bloodstream. If you're engaged in that activity, that trigger or cue will automatically kick in. The third aspect of this, again, is then the emotional component. So we use it to pep ourselves up, to calm ourselves down, to fill boredom, a reward. And so that emotional coping and regulation aspect of how the cigarette is used is another aspect of how people become dependent on tobacco. And that becomes a relationship, and especially in the clinical population that we work with, where many times due to other substance use disorder or mental illness, the quality of relationships to other people or family members may have been damaged or in need of not offering them the type of emotional support that those relationships could offer. So there is one entity, one relationship that the person has in their life that's 24/7 and arm's reach away, is non-judgmental, and offers something that they're looking for in terms of support, and that's their relationship to their cigarette. So the physical, behavioral, emotional aspects of the overall dependence on the tobacco is in different degrees in every one of these areas, and we need to explore that to determine the appropriate intervention for each of these areas. So looking at the physical now, we want to look at the use of nicotine replacement therapies, how to properly use it. Diet recommendations. People regulate their mood through food. We want to identify their caffeine consumption, sugar consumption. I'm going to speak more to that. But if someone has a very high use of caffeinated beverages, or they eat a lot of sugar products, I will ask, we're going to work on that too. I've learned over the years that there's a strong correlation here, and I don't ask people to reduce or stop their tobacco use without addressing those other 2 areas. I've never in 30 years have been successful if someone is heavy duty into caffeine and sugar that they're able to establish and maintain tobacco abstinence very long. So we talk about how we can modify diet, and I'll speak more to that in a minute here. Relaxation techniques, deep breathing exercises in different ways are very helpful. The inhalation process, when one draws in smoke into their body, that's a muscular action. The intercostal muscles around the rib cage are actually drawing the smoke into the lung. And so that's muscles have memories where there's this reflex response, and so you can mimic that through deep breathing and promote a relaxation response as opposed to inhaling the stimulant of the nicotine. Any kind of physical exercise is highly encouraged, so we would see to what degree of exercise tolerance one may have. Does that mean taking the dog for a walk after dinner, or does that mean hitting the gym or going for a run? But we want to try to identify different ways that we can help people identify what they can do in that area. And then craving management. One of the more fundamental things that we want to teach people to become confident in their approach of changing their tobacco use behavior is when you are experiencing the thought of a craving. Craving sometimes can just nibble at your heels. Other times it comes out and bites you in a more severe type of feeling. But you want to be very, very competent in managing that. And again, I'll speak more to that in a minute in terms of how we can have that discussion. Now, I did mention the caffeine, and as I said, the coffee drinking or some of the Red Bull and the different kind of heavily caffeinated beverages can be very popular among our clinical population. So I will always explore that with them as well. If one stops putting tobacco smoke into their body, the nicotine, caffeine then becomes metabolized differently. And what we're going to find is that you'll see that people can become very anxious, very depressed. You'll find evidence of sleep disruption, and they won't necessarily make the connection. They'll think it's tobacco withdrawal as opposed to the fact that the caffeine is causing these types of reactions to their life. So again, reducing caffeine is a fairly easy process. I often will ask people to first, when you brew your coffee, if we're talking about coffee, or you buy it at the store, order it half decaf, half regular. So you're reducing your caffeine intake right from the get-go, and you're probably not going to miss it a whole lot. If you do that for a week and a half, start weighing more heavily into the decaffeinated and just add a touch of the caffeine, or start looking at replacement beverages that are non-caffeinated, where we may spend 3-4 weeks just working on gradually reducing the caffeine that they're using. People will report that they feel better just by doing that. Just become more alert, more energetic, to concentrate better. So just eliminating some of the caffeine can be encouraging as well in the overall process. But then when we get to the point where, again, we're reducing or establishing tobacco abstinence, that will make a world of difference. Now, the behavioral plan is truly a looking at a day at a time, segments of the day. We can break it down into hours. We're going to identify a menu of replacement activities. What are you going to be doing in your morning that looks different than now, or lunchtime, or in the evening? Identify and address any barriers, the high probability parts of your day or environments that may make this more of a challenge for you. And here's an example of that. This is a form that I actually use. HALT is a slogan indicating 3 or 4 areas, rather, of where we're most vulnerable. It's when we're skipping meals and we're hungry. Perhaps we're angry about something that we need to process. If we're bored or feeling lonely, we're vulnerable to craving, as well as if you're burning the candle at both ends and not getting the right rest, being tired will also make one more vulnerable. So basically, on a day-at-a-time overview, a calendar type of a thing, I'll ask people to write down their predicted activity for the day. So do you have to go to school? Do you have to go to work? Are you going to a program? Do you have a group? Going to the gym? You just write down all of your known activity that you have planned for the day. And then we fill in recovery supports. So the morning might include your affirmation, your daily reading for the day. It might include putting on your skin patch after your shower, or those types of things? Are you going to be doing your deep breathing exercises at certain points during the day? Are you going to be calling a friend or someone in your sober support network that can offer you some encouragement? At the end of the day, are we going to take an inventory of how did it go? When was it more challenging, and I can learn from that experience to get better at this for tomorrow and how I approach the next day. So it's looking at the recovery supports. The easiest way to change behavior is to change the environment. Rearrange furniture. People sometimes overlook that, but I am guessing that being creatures of habit, we tend to sit in the same spot in the living room when we're watching television. And as a cigarette smoker, if you smoke in your home, there's probably an ashtray on the coffee table that's just to the left or right of where you're sitting, and there's this now very well reinforced routine that's a huge tobacco trigger. So maybe when we're stopping our tobacco use, rearrange the furniture, put the TV in a different spot of the room, sit in a different chair, make sure you have your replacement diluted fruit juice or something that you can sip on as you're watching television, but actually rearrange the setting. And that's not only for one's home, but it can also be for your place of employment if you have an office or something where you can rearrange the physical way that the furniture is positioned, that sort of thing. Again, developing strategy for high-risk situations. I talk about high energy and low energy activities because we want to have a plan so that there's structure in how we're approaching that day, so we can learn how to manage the challenges in this kind of evolving process. On the other hand, we don't want to be rigid about it. So maybe you plan to go to the gym, but you're just feeling lazy that day, or it's raining outside and you don't want to go for the walk. So you want to think of a plan B as you're designing this. And again, some people with just too much structure will be a concern. They're not going to like that. So you again have to collaborate with your client and actually identify to what degree do we want to identify how we can put structure into the day at a time of approach. Now, enhancing confidence is key, and this is I want to talk about learning to drive a vehicle tobacco-free is one of my favorites. This is especially helpful in someone that is heavily smoking a lot of cigarettes, more severely nicotine dependent, where you want to help them get a taste of how behavior can change and they can get comfortable with it. So before we actually start talking about establishing total abstinence, I may ask somebody, would you like to learn how to be comfortable driving your vehicle without using tobacco? Can we develop a strategy together where you can start to learn how to make that happen? And the strategy then, this is just sort of a general way that we approach it, but you clean the vehicle out, okay? You want to get all the nicotine stains off the windshield and clean out the ashtray and make it, sweet smelling and nice and clean, and turn that into a tobacco-free setting. In other words, not only should you not smoke in the vehicle, but no one should. So it becomes now a tobacco-free environment. Commit to abstain while driving the vehicle. So we're not asking people to be uncomfortable with this. If you're driving the car down the road and you are really wanting a cigarette, well, smoke a cigarette. But stop the car and get out of the vehicle and smoke it outside, not in the vehicle. The commitment is to make that tobacco-free setting and maintain it. Keep the cigarettes out of reach. So you don't want them in your shirt pocket or in your purse or laying on the dashboard. Throw the purse or the cigarettes in the trunk so that you're not just automatically reaching for them. Have a replacement, the hand-to-mouth aids. So again, a water bottle that you can sip on. Dental picks, Tic Tacs, sugar-free lozenges, things of that sort can be very helpful. Consider an alternate route while driving. Again, there's different triggers that are common in our routine routes where we, travel to work or to school or to regular places that we go. When you get to that intersection of Main Street and Broadway, you'll always find yourself lighting up a cigarette or butting one out where it becomes a routine. I developed a program for our city fire department, and the firefighters used to joke about this, but they actually would say that if they had to do a task where they would take their fire truck over to a particular part of the city, they would say, well, that's a 2-cigarette task, or that's a 3-cigarette task, where they actually measured the distance by how many cigarettes they would smoke getting from the fire station over to the location of where they needed to do their work. So the cigarettes, again, become so woven into that automatic way of how and when we're driving at different places that there are patterns there that if we change the way that we're getting to the destination, it can also remove some of those triggers or cues. Now, the key to all of this, and this is an example of how the strategy can play out, would then be to acknowledge that reinforcement is key. I will suggest to folks that the first week of doing this, it's not going to be great. You're going to find it a little irritating, and it may not be comfortable as of yet. But what we find is that as you do this for 2 weeks or 3 weeks, you'll start to identify days that you won't even think of a cigarette while you're driving your vehicle. And after a month or so, you may be very comfortable where that setting now has been reinforced so much as a tobacco-free setting that is the new norm. And this is just a lesson in terms of helping people to understand, this is to help folks understand how we reinforce new behavioral patterns. The old patterns will fade. And this can be a real help in terms of enhancing their confidence in taking this to the next step. So here's another one that is a favorite of mine. Would you like to learn how to be comfortable going to a sober support meeting and not use tobacco? So an Alcoholics Anonymous meeting, a Nicotine Anonymous meeting, somewhere where folks will be using tobacco. Typically it's before or after the meeting, not during it. But this, again, is an important part of one's lifestyle and recovery, so we want to develop a strategy for it. And some of the ways that we approach this would be, first of all, going to the meeting with some support. So if you have a friend that does not smoke, you may want to have that person go with you for some support. Arrive late and leave early. Okay, there's no smoking in the room. It's typically before people go into the room and they're gathered outside of the facility or whatever, and then afterwards. So to avoid the times where people are actually actively using tobacco, you may want to attend the meeting, but show a couple minutes late and leave before everybody walks outdoors. A firm commitment to abstain prior to the meeting. So again, if you have your personal slogan or your tangible, your polished gemstone or your coin or your keychain with the picture of your child in it or whatever it is that's a reminder of your personal motivation, allow yourself a little pep talk and affirm how this is important to you. Have a replacement hand-to-mouth aids, again, with you, the things that we talked about before, but you want to make sure that the water bottle, dental pick, sugar-free lozenges, Nicorette, or some NRT might be appropriate there as well. Share the tobacco-free goal with your sober support network. And you want to do this, first of all, it's the appropriate setting. Folks go to these meetings to support one another in lifestyle change. So to kind of let your network of those that you see at these meetings, the folks that you know, It's important to help them know this. And it's important because also you don't want someone to be offering you a cigarette because they don't realize the focus that you have in place right now. As you're pursuing this, again, it takes time. So we're going to talk about weeks of reinforcement where you're then extending. The behavioral psychologists call this shaping, where you'll do this and maybe you'll spend 5 minutes outside before you leave instead of leaving early. So you'll have people around you that are lighting up. If you're comfortable with that, then maybe that 5 minutes can go to 10 minutes or 10 minutes to 15 minutes. And if there's any evidence at all where you're starting to romance the thought of joining them and lighting up or makes you feel uncomfortable, just make sure you leave. But what we'll find is that people will gradually accept more and more comfort within that particular setting, and after a while will report that it's not a problem for them. Now, craving management. Oops, apologize here. Okay, my automation didn't work here. The craving management. A craving, again, is something that we want to spend a lot of time talking about because a fundamental coping skill is not to be frightened by the craving, but to learn how to manage it. A craving has a timeline. It usually begins and grows, where then it has a peak to it, where it becomes the strongest. When we smoke at that peaking time, the craving will leave us. If we choose not to smoke, the craving will also leave us, but it leaves us in a different way, and it takes a little bit longer for it to go away. So when we're choosing to not smoke when we experience the craving, this too shall pass. We acknowledge that the time element has started, okay, and this is what would be assessing over time as I'm meeting with folks in subsequent sessions of the timeline. How long did it last? What was the frequency? What was the duration? But then we have to develop interventions. This too shall pass. What am I going to do when I'm experiencing the craving to help it go away? And there's a set of different things that we'll do. Change the environment again. You may want to just walk out of the room or wherever you are. Shift your focus away from the feeling of the craving. And so that could be calling a friend and engaging in conversation, playing your guitar, anything to keep your hands and your mind occupied with arts or crafts or a jigsaw puzzle or those types of areas where you can focus in on. I talk about a cold shower here. It could be cold or hot, or it could just be washing your hands and face in cold water, but something that's distractive like that and helps shift the focus. I've had people in their first day or their first several days of not using tobacco take 4 or 5 showers a day, where part of their day-at-a-time approach was segmenting the day into times where then taking a shower, they never wanted a cigarette afterwards, and that would be something that they could just kind of help, identify the segments of the day. Just brushing your teeth can be helpful for some people. Any kind of physical exercise. Again, we talked about relaxation, breathing, meditation, prayer. The fructose, eating a piece of fruit can change blood sugar level. That can actually help with tobacco craving, and of course nicotine replacement therapy. So the idea here is identify the different strategies and the coping skills that you can use. Find one that'll work for you when you experience a craving at home versus at work or in other settings, because the strategy may look a bit different. You can have fun with this. I'm going to give the craving a name. Bubba's going to show up after lunch. How long is Bubba going to hang around? And you can actually then do an analysis of this, process it with your patient as to how is the duration and the frequency of the craving presenting itself. And what will happen is the message again, as we reinforce new behavioral patterns, the old patterns fade. over time, the frequency and duration of craving will fade away. And so we want to have realistic expectations of how that change process occurs, but make sure you have the tools so that when it does occur, you're going to be able to manage it well. Another key point that I want to mention on this is first-time experiences. And the sets of triggers or cues that can prompt a behavioral craving is going to look different in the wintertime than in the summertime. We're going through a seasonal change right now, and if someone established tobacco abstinence during the cold winter months, the first warm day of spring where they're outside and maybe pulling out the lawnmower for the first time or the grill, that may not be 3 months of living a life without a cigarette. That's day one all over again, because it's the first time you're within that set of stimuli, the different type of triggers that would be reflective of doing lawn work or barbecuing your lunch. So to understand again that we take this a day at a time, and we realize that different triggers will be presenting themselves, and we want to make sure that when it happens, we feel confident in how to manage it in a healthy way. Now, the emotional piece of this, again, is pretty typical to what we find in traditional drug counseling. The benefits of being tobacco-free is a way that we can counter any feelings of loss. So if someone I see that I know has been tobacco abstinent for a period of time, the first question I will always ask them is, how is your life better by being tobacco free? I want to focus on the rewards of what's happening. The emotional adjustment to all of this plays into the action stage of change differently than the maintenance stage. When we're in the action stage, it's brand new. We've just made the behavior. There's that sense of void. I should be doing this. No, I don't do it anymore. So it's very fresh, and you feel the sense of loss that accompanies I should be smoking now. No, I don't do that anymore. When somebody's in a maintenance stage, it becomes more past tense. I used to do that. No, it's not what I'm choosing to do any longer. So when we're talking about the grieving, the emotional aspect of this, there's a variety of things that we can help and assist with the process, and journaling always is good. Writing a letter to your cigarette, saying, the goodbye letter, again, a letter of encouragement, or you identify we've had some good times in the past, but at this point in my life, it's time to do something different. I'm not going to smoke any longer. So prayer, meditation, any kind of support within your network of your sobriety support community, social media. Again, the Quit Line, Nicotine Anonymous. There's a variety of different things. Any kind of means of expression, again, can be very helpful in processing feelings around the emotional grieving, and drug counselors are pretty tuned into this. So I'll have people write songs, if that, or poems, or anything, just to kind of express the change to their lifestyle and how they're letting go of the old and embracing the new. Now, relapse prevention is another area that we want to talk about here. I don't really even like the word relapse. I prefer the term returning to use. And I say that because relapse in itself has a connotation that can be negative. I know, and this is my very personal view now, but as I know people have different points of view on this, but some therapists like to talk about a relapse versus a lapse versus a slip, so there's different degrees of returning to use that is reflective of where you are in terms of motivation. I don't like to make that distinction because I think that it sounds judgmental. is a lapse not as bad as a relapse? Are we kind of measuring it in some way? I don't believe that people fail in anything that they do, that we can learn where there may be gaps in our plan that we have to reinforce or modify the recovery plan to address, and that's a healthy part of the learning experience. But so the return to use is a common trait in any type of tobacco use or substance use disorder. And in the discussion, when we're first developing our day-at-a-time plan, I will make sure that that's part of what we talk about. So the expectation is that when we have a tobacco use disorder, we are going to use tobacco unless we identify how to intervene so that we don't need to use it. So a return to use indicates a need to modify the recovery plan. We're learning something new that we didn't take into consideration as we were developing Plan A. So now we have to, let's look at the experience of this return to use, do a behavioral analysis to identify internal and external aspects of how it played out. Okay, internal would be mood change. If you're not getting the proper rest, again, you were skipping meals, or you were upset about something, there was some stressor in your life that made you more vulnerable. Maybe you're not taking your medications, or you know what, a whole host of things. And then external would be primarily environmental. But you're looking at all of those elements of what kind of led to the return to the use, and then what can we do to sort of bolster up our strategy here so that when you're faced in a similar situation again, you'll know how to address it and not need to return to use. So Plan B is to enhance the individualized strategy to manage things a little bit differently, and that can be turned into a very positive growth development part of the process of learning what we need to do. And so that's the way we talk about it, that relapse is going to happen unless we figure out how to intervene. There'll be times where maybe we won't have all the answers, but if there is a return to use, we can use that as a wonderful experience to make our plan better in meeting your needs. Now, this is a PDF, a graph that I developed we use for training here, and I'm looking at my desktop. If you're enlarging this on a large screen, it probably would not look so great, but this is, if you can read it, there are different areas of the counseling approach and methods reflective of the different stages of change, which is a nice little guideline that might be able to something you can use. I want to just say a few things about pharmacotherapy, and then we'll hope to have a little time left here for Q&A. The use of pharmacotherapy and behavioral counseling, again, is evidence-based acknowledgement that that is where we're going to see the best outcomes. Making sure that we're properly dosing the pharmacotherapy. More is better with this clinical population, both in pharmacotherapy and in the intensity of the tobacco interventions. One of the advantages we have in our field is that we do have a lot of contact with those in our program. So this can be helpful in terms of the frequency, again, of where we can monitor folks and offer additional counseling. Now, when we're talking about the dosing of nicotine replacement therapy, the guidelines will say that, generally speaking, we absorb 1 milligram to 1.5 milligrams of nicotine from each cigarette that we smoke. So, you know, you do the math. If someone smokes a pack a day, figure out how that would translate into a replacement therapy. What we've learned in this clinical population is that guideline doesn't necessarily work well. And the meaning behind that is that people smoke cigarettes differently. Many folks will inhale much more deeply. Think of a cigarette as a container of nicotine. So how deeply you're inhaling, the frequency of hand to mouth, we will find often that people that we serve in our programs literally smoke the cigarette right down to the filter. I mean, they get every ounce of nicotine that they possibly can get out of it. Many folks that are low income or homeless and have no money may smoke fewer cigarettes, but they often will relight the cigarette. So you only need 2 or 3 draws of nicotine in your body to rid of any kind of withdrawal feeling. So you may do that and then butt the cigarette out. When you butt the cigarette out with the intent to relight it later, the resin, the tar buildup at the end of that cigarette has a real strong concentration of nicotine in it. So when you relight it again, you're getting this big wallop of nicotine. One cigarette could represent 3 use episodes. So when you're now in your intake and you're meeting with the prescriber in your treatment facility to determine what would be appropriate in terms of dosing NRT, if you ask how many cigarettes a day you smoke, that person may say 5 or 6. But the amount of nicotine they're getting out of those 5 or 6 cigarettes may be equal to a pack or more of someone more casually smoking with less inhalation and less drawing, intense drawing on the cigarette. So you really have to dig a little bit in terms of identifying just how much nicotine one is getting in order to make sure that we're properly dosing it when we're starting someone out on one of these nicotine replacement therapies. And then we teach people to monitor this. So we're looking, again, within the first 24 hours, if they're in your program, the signs for withdrawal or toxicity. Do you need to titrate the dose in any way? And so it's identifying the various signs there to determine kind of are we using the appropriate dose or not. And again, understand what the symptoms are. So there's, in addition to craving, we see a host of different things here that can be presenting as symptoms. And so to just have an understanding of the cause of it, the duration, what we can do to relieve these symptoms is all very helpful information. There are no safety concerns. This is more recent information right from the FDA, but we believe strongly in combination therapies of NRT. You have your transdermal, your slow release in a skin patch, and then maybe a more fast-acting gum or nasal spray. The combination works to see better for most folks. Extended use, the 12 weeks is safe. Typically people will automatically self-terminate after they feel they don't need it anymore. So a lot of times we'll just ask people to use it until you feel that it's no longer necessary, and we don't really put a number on how many weeks of using it. We just want to make sure they have the product available to them. And again, there's no significant concern, according to our latest FDA reporting, that smoking a cigarette while you're using this NRT is not going to put you at any great risk. Now, if there's concern there due to some medical comorbidity, the person has significant cardiac disease or whatever, you of course would collaborate with the appropriate cardiologist or whomever. So final thoughts, we want to provide a client-centered individual tobacco recovery plan, focusing, again, collaborating with the patient to identify what skills they need to learn in their lifestyle to become tobacco-free, alcohol, tobacco, and drug-free. Maintain an objective, collaborative, non-judgmental relationship. Talk about post-acute withdrawal as well. The acute withdrawal is significant and can be helped by NRT, but we will have over the period of weeks and perhaps months after your last cigarette, you're going to see, again, there might be some sleep disruption, there may be forgetfulness or memory, short-term memory issues, emotional overreacting or underreacting, very similar to post-acute withdrawal syndrome that we find with alcoholism. We'll see the symptoms mimic that with tobacco use. As I said a minute ago, more is better. So the frequency and duration of both the pharmacotherapy as well as the behavioral counseling, we have found a dose-response relationship. The more intense of the intervention, the better outcomes that we see. And again, always reinforce the benefits of being tobacco and drug-free. So again, how is your life better is the question that you want to constantly ask folks. We believe what helps people make the decision to stop their tobacco use is when they recognize the negative aspects of how tobacco is impacting their life. That does not sustain abstinence in the long haul. What sustains the abstinence is that they realize they're better off without the cigarette. So we want to highlight the rewards of that lifestyle change. So I think we're almost out of time, but we do have perhaps time for a question or two. So Janelle?
Let's get a question in here. One person wrote in, how do you feel about quit dates?
About
it
a quit date?
It seems to me that quit dates increase anxiety. She says that sometimes quit dates increase anxiety and possible fear of failing. She often recommends patients to set a date to start their meds if that's their choice and go from there. It seems to work. What are your thoughts?
Yeah, I totally agree with you. I'm on board. I think that, again, the elevation of the self-efficacy, making people feel confident in the behavioral change is important. Quit dates can be very beneficial in a population when we're doing brief interventions. What I'm talking about today is not a brief intervention. It's an intensive intervention. It's more looking at, again, the skill sets of the individual, the nature of their motivation, and working with them to help enhance that process, that sense of confidence, and helping them to get a taste of little successes that grow into big successes. So when I talk about learning how to be comfortable while driving your vehicle without a cigarette, or going into some high-risk area and learning to do that in that setting, that could be while they're still regularly using tobacco in the regular pattern. But when they get a taste of how, yes, change does happen, I can do this, it inspires them to then go a little bit further. They will know when they want to establish. I don't focus on the quit date. I don't push the issue with the date that you choose. I think there's a natural flow when you have these conversations with people and they're learning these skill sets and they're applying them and they're seeing the benefit of it. They're going to come to you someday and you're saying, Tony, I think Monday is the day that we're just going to totally throw the pack away, and you'll hear that from them. It's not a conversation that I will initiate. So I think there's a natural process where this will then kind of lead to where, then again, we want to just make sure you have all the supports you need with pharmacotherapy or some of the understanding of craving management and things of that sort. So I totally agree with you. I think that people they're on their own timeline, and they, we want to respect that, but pushing the issue of you have to pick a date and go for it, with this type of integrated approach, I think I shy away from.
Okay. Maybe one other quick question. When addressing recovery in an inpatient setting, do you recommend that the facility also becomes 100% tobacco-free or offer spaces for clients to smoke?
I recommend 100% tobacco-free for sure. You don't want to have competition, because if you have any place where people can go to smoke, you're going to, they'll choose that. I mean, it's that simple. You're not going to compete with that. That's going to have preference, because the aspects of socialization with their peers and the reason to go there and smoke that cigarette is more than just maintaining blood nicotine level. There's all kinds of social and behavioral factors of why they would want to do that. So it's you don't have AA meetings in your corner bar for a reason. We don't, we have to create an environment that's conducive to the behavioral change where we want to make it happen. Now, having said that, and I'm going to sound like I'm talking out of both sides of my mouth here, but I'm really not. If we had more time, I could probably expand upon this better. Sometimes an incremental change process of moving from a facility where tobacco is permitted to a tobacco-free environment, you can put in places of further restricting locations of where people can use their cigarettes. But the expectation is that at a certain point in time it will be totally tobacco-free. So if the overall plan is to maintain a place where people can use tobacco, I would be opposed to that. But again, if it's part of an incremental change strategy, then that might be something to consider.
Thank you so much, Tony, for all that you've shared today and taking some time for questions.